This has been first time in more than a decade that they have missed earnings.
What I worry about is there's going to be a fear of pullback, right? Because, oh my God, we need to figure out our utilization.
And oh my God, that site. Really, you should go take a look at the site. It just boggles my mind. Who's the famous, the spy author who writes these series novels?
Tom Clancy?
That's it. It literally looks like a Tom Clancy book cover.
It's actually Donald Holmes.
Who's that? I don't know who.
Sherlock Holmes, Donald Holmes.
Donald Holmes, oh my goodness. Oh God.
Bad joke, bad dad joke.
Very bad dad joke. What Sutter Health was accused of doing was, among many things, and I'll give you one example, that if you're an insurer, you would say you would have to contract with all the hospitals in our system and all the physician groups in our system. Naturally, you can't make a narrow, affordable network.
It's just hard for us to see it coming from a provider organization because we usually see them as the front line who's treating us and, do no harm, right?
Hello and welcome to MedCity's Debunked news show, where we analyze healthcare news and debunk some myths from time to time. And we do it without fluff. Wow, we're in a period of real uncertainty and chaos right now. And so you, our audience, have to find trusted sources of information and we hope that MedCity News and this show falls in that category where we both inform and entertain you. So Samir, where do we begin? We begin with how the mighty fall, right? Of course, I'm referring to UnitedHealthcare, which because of their inability to forecast properly on how high medical utilization would be in their Medicare Advantage population, I mean, their fate got sealed in the stock market when they reported their earnings.
Yep.
The stock slid 20%. I mean, this has been first time in more than a decade that they have missed earnings. And I got to tell you, I was, quite taken aback. I mean, the CEO, Andrew Whitty, called this unacceptable and unusual and unacceptable results. I guess what surprised me was that other insurers also saw certain spikes, Elevance, Molina, Centene, but none of them had this sort of meltdown in the stock market. So now we're recording this show before Humana has had a chance to report, so we don't know how Humana is going to be affected. But let's assume that they are not affected like UnitedHealthcare. What does that say that they had such, a bad quarter? Is it a blip? Do you think it'll happen again? What's your sense?
I mean, first of all, wow, the hits keep on coming for these guys. I mean, They had a tough 2024. Right? I mean, cybersecurity, cyber attack, right? You when your CEO passes away.
Not passes away, is murdered.
Yes, sorry, I should be more blunt.
Oh my
Got
God.
murdered, right?
Yep.
And then they have potential government sanction, investigation going on medical practice billing issues as well. So they've got a lot going on.
They do.
They're a heavy plate, right? So, but first of all, I mean, I'm seriously going to say this. You are UnitedHealthcare. You're big. How did you not see this happening? Because here's the thing, right? Rise in care use or utilization, right? Medicare Advantage business coming in far above what you expected in 2024. I mean, how did you not plan for this? In 2023, I know it wasn't as severe and you were coming out of COVID and stuff. They predicted better. They actually, their financials were more in line with what they expected and things. But I mean, there is a little bit of, what I worry about is there's going to be a fear of pullback, right? Because, oh my God, we need to figure out our utilization. Do we pull back a little bit on the reins? And that's not going to help anybody.
You mean pull back in terms of denying claims or not providing services? What do you think?
Managing utilization, actively, right, sort of pursuing and managing the business. So I think there could be, and that they really need to figure it out, and I think they will. I honestly do think that it is a blip. And look, I don't know what the cyber attack caused. I mean, look, there's a lot of attention, that was sort of forced in other areas, right?
Yep, absolutely.
So look, they're a behemoth. I feel like they're going to figure it out. And now look, Trump wants to increase reimbursement for
Yes,
MA. I mean,
that's
like,
right.
it's here for you guys.
Yeah.
Right? Like, here it is. Take advantage of it. So
Yeah.
I'm thinking it's going to be a blip. I'm not going to get too excited, too worried about this unless it happens again another quarter. Then I think you have cause for concern about, like, what are they doing?
Yeah.
Right? And look, the stock market hit that happened, it did momentarily. The other stocks dropped as well. I think Humana had a 5% drop too, not because of them, but like the sector gets impacted.
Sure, contagion.
Yeah.
Yeah. It's what you mentioned about reimbursements. Yeah, the reimbursements are going up. I believe the average payments were proposed like 2.23 in
Yeah.
2026. That's going up to 5.06%.
Yeah,
If
double,
I'm not, more than double. So that's good news for the insurance companies. The thing that I have to mention is, I've actually, since we're talking about Medicare Advantage and UnitedHealthcare, I've been seeing these sponsored posts, sponsored content by UnitedHealthcare on Medicare Advantage. And granted, I'm not a big fan of sponsored posts. I'm in the media. They do help me get my own paycheck, though, so I can't say a ton against it. But the thing that was interesting is their headline was something like that: Medicare Advantage is cost effective and helps seniors,
Right.
pay less.
Yeah, yeah.
And I don't know where they're drawing that data from, because the actual truth is, like, the Medicare Payment Advisory Commission, this is the group this is actually a independent congressional agency
Yeah.
that looks at Medicare payments and things like that. And in March of this year, they put out a report saying that in 2025, CMS will have paid $84 billion more for
Yeah.
MA enrollees than if those same enrollees were enrolled in traditional Medicare, and that's 20% more. So there's that argument that it is not cost effective. But then I have also heard from other MA plan CEOs that traditional Medicare is not affordable. So seniors are actually finding MA more affordable because some of the plans also have Part D, which is prescription drugs, included. So there are zero premium or low premium plans that you can buy on with Medicare Advantage, which you couldn't in traditional Medicare. I guess my question is, how does the math add up? I mean, the government is paying more, individual seniors are paying less. Who is making up the difference, right?
I mean, partially, I think it might be too early to assess who's going to be left holding the bag. Right? I mean, somebody
it's
is going to be left
taxpayers.
holding the bag, and
Yeah.
that's what I'm saying, right? So if you're talking about mismanagement from the insurer's perspective, and if that continues, someone has to foot the bill,
Yes.
right? So if government's plans and utilizations and reimbursements are set, and if the insurer is not going to pick up the tab, who's going to pick up the tab?
Yes, you and I recently went through this process of Medicare application. Actually, not for myself. My parents are obviously immigrants to the U.S. They've now been here for more than 5 years, so they qualify for Medicare. Obviously, we buy into it because they never worked here, and
Yes.
unlike you and I, they didn't pay into it. It is not cheap. It is
No.
not cheap. It is cheaper than going on the exchanges, much
Right.
cheaper than that. But it is not cheap. So, but I still can't imagine that people like that, like my parents who are buying into Medicare, would fill that gap. I mean, I don't know what the percentage is. I have done no research on this. But the whole Medicare Advantage thing actually was recently at a conference where I interviewed an MA plan CEO, and he acknowledged that there are real issues with MA in terms of nefarious practices, in
Yeah.
terms of aggressive marketing tactics in the role that brokers and pay. So, but Medicare Advantage is so popular. So reform should come. There has to be a way to rein in costs. Like with so many things, we don't know exactly how.
I mean, the jury, I still go back to the same point. I think that you're going to have reimbursement hikes happen again now, right? In terms of what the proposed plans are for MA. You have some data that's assessing the care utilization that's happened. And I think it's going to be interesting to see, you mentioned Elevance and Molina, but how Humana does and all the others do. And where is the cost utilization burden coming from their perspective, right? Some of it's the drug utilization, the PBM stuff that they've talked about. So
Correct.
I think it's going to be early to determine. And look, it's not like we haven't gone through this before. in our industry, we've had plans and reimbursements and different models come and go. So I'm not saying that it's too early to pull the trigger on it, because there's also a lot of private investment that's gone into MA.
That's true.
Right?
That's
So
true. That's
I
true.
just think the truth is going to definitely lie somewhere in the middle, and then it's going to be a really tough conversation. Yeah, like who's going to end up picking up the bag? Who's going to fill the gap?
I have no idea. I mean, now you have ICRA, right? The individual. I'm
Yeah.
going to mess up the acronym, but the idea that this is just like 401k, retirement became 401k,
Yeah.
health benefits will become this
Could be.
this thing. And as a healthy individual, it makes a lot of sense to me that I could take and go wherever I want.
Right.
And every time I don't have to be tied to my employer. I like that, but I don't know what it does for seniors.
Yeah.
Anyway, now we come to a new section of our show, which I'm calling "What Did the Trump Administration Do Now?" So I will read a piece of news to you, Samir,
Okay.
and you have to give me your reaction, okay? And then you will do the same to me.
Sure.
So now, NPR reported in late April that HHS was canceling a large-scale NIH-led women's study. Now, it was called the Women's Health Initiative, and that study had been going on for decades, and it was basically trying to get a better understanding of how women age and the health issues tied to that prospect. So up until this study was doing all the different types of research, it was almost dogma that if menopausal women took hormone replacement therapy, then it protects the heart. That was
Okay.
the dogma back then. This was the study that disproved it. So now HHS comes and announces that, hey, we're going to cancel this study. Predictably, there was a volley of criticism. 24 hours later, they're walking this thing back. Your response?
One word, right?
One word.
Stupid. Next.
All right, one word, stupid. All right, the next is even more hilarious. Well, if you don't cry, you have to laugh, right? We're in that state right now in our nation. So there was this website called COVID.gov.
Oh yeah.
The COVID.gov site had statistics and data on COVID, on vaccinations, on what kind of treatments are available. Regular data-driven healthcare website.
Yeah.
That has completely been overhauled into a site that makes Trump look like the dogged detective that finds the true origins of the COVID-19 crisis that we faced, or the epidemic, I should say, rather. So they don't look at anything. They just have, basically homed in on the idea that this was deliberate and it was a man-made leak from Wuhan, from China. And so you have
Supposed to say China.
I'm supposed to say China, that's right. I can't, I'm not so good. But if you look at the website, it's like a spy novel cover or a movie trailer. There's black background, Trump in the middle, like going towards the lab leak, and then data from House Republican report that also concluded that this was a lab leak. By the way, if you guys didn't know, no such determination has been made. Now, am I saying that it could not have been a lab leak? No. But there is no scientific consensus that this was indeed a lab leak, and we're probably never going to know the truth because China is not going to be that forthcoming. But is that going to stop the Trump administration from claiming? And oh my God, that site, really, you should go take a look at the site. It just boggles my mind. Who's the famous, the spy author who writes these series novels?
Tom Clancy?
That's it. It literally looks like a Tom Clancy book cover.
It's actually Donald Holmes.
Who's that? I don't know who.
Sherlock Holmes. Donald Holmes.
Donald Holmes. Oh my goodness. Oh God.
Bad joke. Bad dad joke.
Very bad dad joke. But your response?
Well, I already used stupid, right?
Yes, you did.
It's a synonym for that. I don't know. Oh, ridiculous. Actually, maybe the website's very entertaining.
It is entertaining, except you don't get any data anymore,
That's
right?
why
This
I'll
is
go
the
with
conclusion.
ridiculous.
Yeah. Okay. Now you.
My turn?
Yes.
Okay, I'm going to read now. Okay. All right, here's one. A budget proposal includes eliminating the Social Services Block Grant, a crucial funding source for Meals on Wheels, in 37 states. This move threatens the well-being of over 2 million seniors who rely on the program for daily meals and social interaction. Advocates warn that such cuts could lead to increased food insecurity and higher long-term health care costs due to malnutrition and isolation among the elderly.
My one-word response is, well, it's two words, absolutely depressing, right?
I was going to go with sad, yeah.
Yes,
Exactly.
sad, just sad. Anyway, but you have to give the devil his due. So there is some good news. This happened earlier in April. When the measles outbreak was going on, and it's still going on, it's only getting worse. RFK Jr. had earlier sounded wishy-washy on vaccines. He wrote an op-ed where he, basically said it's sort of optional, but not anymore. In early April, after he visited the parents of a child who was unvaccinated and had passed away, he wrote this lengthy post on X, and the key golden words were, the only effective way to prevent the spread of measles is the MMR vaccine. He actually said that. So that's a victory for science. It's a victory for at least this vaccine, given that he has put a stamp of approval on it. I just hope that he puts the resources and the enough public resources and announcements so that people in Texas and other places actually do get the MMR vaccine. I mean, we didn't even have to question this 10 years ago, and we do have to now.
Yeah. I guess he's got to go meet more people who've died from COVID that did not get vaccines. I mean, shit, science and data does not lie, I guess, right? I mean, numbers don't lie. Maybe there's hope for him.
Well, we'll see. I mean, like I said, I do appreciate what he's doing on the food side. He actually had a press conference again in April where he basically said sugar is poison. As someone who loves sugar, I mean, I love my bakery items.
It's true, though. Yeah.
I still agree that is the right message to send to Americans. I mean, why, in court chronic diseases by a diet that is so full of sugar, especially stuff like soda. And stuff. So
for sure,
I am for whatever stick or carrot he uses to get.
Both of them don't have sugar.
Both of them don't have sugar, correct? To get us off of our very bad diets in the U.S. And finally, we get to this interesting end to a long-running lawsuit. I don't know, Samir, if it registered with you or not. Back in the day, this is, I believe, 2012, where Sutter Health was sued by a group of individuals and businesses, saying that they were essentially acting like a monopoly and driving up costs for insurance companies who would then, and employers who would then pass on the increased costs to employees and members through higher premiums. And what Sutter Health was accused of doing was, among many things, and I'll give you one example, that if you're an insurer, you would say you would have to contract with all the hospitals in our system and all the physician groups in our system. Naturally, you can't make a narrow, affordable network because you have to do all of this. So what happened was they initially won the case. The jury came out against the plaintiffs. Sutter won, and then there was an appeal. And in the appeals court came back and said, we have to have a new trial because the jury wasn't informed properly. And there was some stuff about, evidence where they had done other similar practice were not included in that trial. So the federal court decided that you need to have a new trial. And right before the new trial was supposed to begin, they settled. And then the amount of, I believe it's almost $230 million that Sutter is going to pay out. It is not, however, accepting any liability. But if you had any questions about liability, you could probably also think about a similar lawsuit that actually another union had filed. And the Attorney General of California had sort of signed on to it. And actually that went heavily against Sutter, and they had to pay a settlement, and they had to agree to a monitor from the state and all of that. So you know, every time I think about who drives up healthcare costs, we always look at, oh, pharma is the bad guy, or the PBM is the bad guy, or the middleman broker is the bad guy. But you know, there are providers in the mix that also drive up costs in various ways. So,
I mean, everybody's trying to make a buck. Right? At the end of the day, all these folks, like you can be for-profit, non-profit, whatever it is,
yeah,
you're still running a business.
yes,
Right? So I think that's what it shows you. Nobody is, you know, immune from this.
yes,
Right?
yes,
And there's a separation between clinical staff and administrative staff, right? So like,
right.
I don't know if the average person will sort of take their frustration out on their physician from Sutter who's treating them, because this is usually happening in the boardrooms, the fat cats, the administration, whatever you want to call it.
Mm-hmm.
But it kind of shows you, I mean, it's like there's no one, everyone's trying to get a cut ahead, and they're all trying to run a business. Even nonprofits have budgets. We've seen some of the inflated salaries some of these executives make, and they're working at nonprofit organizations, right?
True.
So
True.
so I think that's, it's not shocking. It's not going to be an anomaly. I think you'll continue to see this stuff happen, especially if you look at all the different programs that are being instituted that we're trying to fix healthcare. All these different plans that are coming out, reimbursements, programs, drug programs. There's going to be always somebody who's going to be trying to gain the system, right? So I don't think it's just hard for us to see it coming from a provider organization, because we usually see them as the front line who's treating us and, you know, do no harm, right?
Yes, yes.
But there's other people sort of pulling the strings in the back end. So.
Well, I was hoping that value-based care would be a way where we would get away from all this. But then again, tying it back to the UnitedHealth story, you know, one of the reasons they said that they struggled in their, or you know, in the quarter that they reported on, was that they did not take into account this risk model that they were part of through, this contract that they had signed with the CMS that had a specific type of risk model contract. And it was a VBC contract. And so, you know, I've been hearing a lot about how value-based care is sort of this lovely concept, but very hard to achieve in reality. And I don't know, I mean, do you feel the same way? I mean, I thought that VBC might be a way we would like really put fee-for-service behind us, but then it's so hard to implement because there's so much variations in treatments and things like that. So I'm just curious about, what do you think is the future of sort of VBC?
I mean, look, if you let's just deconstruct VBC for a second, right? So it theoretically, and from an outcomes perspective, and from actually a financials perspective, economic perspective, it makes sense, right? Here's a pile of money. You're optimally going to share that money across the resources, outcome dependent care based payment, right? So one lump sum, you disseminate the, you know, that money. Well, okay, so then let's break that down. I need optimal care coordination. Do we have optimal care coordination? Hello? Are you out there? Like, no. So you're going to have to focus on optimal care coordination.
Right.
So what does that require? Let me see. Oh, you're going to need data to talk to one another.
Yep.
Oh, our favorite topic.
Interoperability.
Interoperability and EHRs and all systems talking to one another. So now as an organization, you need to invest in technologies that are going to talk to one another, right? Integration, technology, tech transfer, right, as we call it. But then care coordination, right, on top of it. So you're putting in a lot of these risks, not to mention, you know, clinicians, do they want the additional burden of administrative burden now, of administrative oversight, right? So now you're going to have more oversight as a clinician. You're used to doing what you're doing, but now you're like, you have to follow this plan. You can't have one more visit, or you can't take this additional more step, because you're not going to get paid for it, right? It's a bundled payment, right?
Right.
And there is inertia from fee for service. Hey, who doesn't like going to Las Vegas and pulling the, the jackpot, right? And saying, you know, the more visits I do, cha-ching, cha-ching, cha-ching.
You're going to lose more money, not win.
But in value-based, yes. But for fee-for-service, the more visits, the more appointments, the more tests, the more I get to ring the register, right?
Yeah.
So you're trying to get somebody off of that to sit there and say, no, do it for the betterment of care, betterment of outcomes, healthier patients, better outcomes. The entire system was not designed like this, right? The fundamental system, we're trying to apply a solution without changing the fundamentals underneath it. The fundamentals were born from, I need to do more visits, I need to do more tests. Now you're going to tell that same person, treat this person, get them healthier with less visits, but share amongst everybody else, right? Do team-based approach, do care coordination. The only way to fix this is that it's the same thing which you did with implementing technology from an EMR perspective. Carrot or stick. If you don't do it, we will penalize you. If you do it, we're going to reward you. So again, please, nobody come start smacking me around and saying remove fee for service. But the point is, till you start removing that dependency and forcing VBC, why are people going to adopt? Right? Now, we have couple of examples of organizations who are seeing gains and seeing improvement in outcomes, Kaiser and Mass General, but their challenges were also there.
Right.
And for Mass General, it was severe care coordination. Oh my God, the work that went into it, right? Nobody's talking about the cost burden or the time efficiency burden that they went through to have those gains. And then for Kaiser, they talk about it very openly, their interoperability, their tech integration problems, right? So yes, they had gains, but look at what they had to go through. And we're talking about Kaiser and Mass General, some of the organizations that are the beefiest out there, and you want everybody to adopt it. So if you don't start reducing dependence on fee for service, then I don't think you're going to have the vast success that you're going to see. And even as for an investor, right? Like we see startups coming in, popping up left and right, VBC.
Yeah.
Yes, guys, it makes sense. And even investors have been pouring money into this area. Oh yeah, let's invest in it. There's even companies coming out that help providers create value-based plans.
Yes.
Right? Right? Like they're helping you basically analyze all your data, use AI and say, here's the formulation of like minimal surgery or outpatient or different clinical areas, right?
Like companies like Aledade, right?
Yeah, I mean, and others too,
And
right?
others.
Smaller and bigger ones, niche, going wider, everything. But again, how are you going to remove my dependence? It's just the easy button.
Right.
It is the Staples easy button. I'll just do another visit.
Yes.
There's Medicare, let me just reimburse, right?
Yeah.
And there's businesses being built on it. And there's businesses that are actually also showing outcome improvement through that. So I just think that you got to break this completely down. And if you really want those value-based models to succeed, well, you can't let me just have the easy button out model, right?
Yeah.
There's an easy button out. So why am I going to struggle?
No, I hear you, but break this down characterization is scary, especially now when so many things are being deliberately broken down that don't need to. I don't know. But anyway, on that slightly uncertain note, which captures the mood of the country, we're going to call it quits on this episode. Thank you again for watching, and do subscribe to our podcast and share and like it and do all the things that social media denizens are supposed to do.
Exactly. Thank you very much.